Today I'll be telling something about myasthenia gravis, an important question irrespective of exam, also an important case history, a clinical scenario what we come across. So myasthenia gravis, the question is usually asked about the causes, the clinical features, or the pathophysiology of myasthenia gravis, the physiological basis of treatment of myasthenia gravis. So what is myasthenia gravis? Myasthenia gravis is an autoimmune disease. It's a neuromuscular disorder of autoimmune nature characterized by weakness and fatigability. The highlighted features are weakness and fatigability of skeletal muscles. So characterized by weakness and fatigability of skeletal muscles that gradually worsens as the muscles are used. Coming to the etiology of myasthenia gravis, etiology means causes. The causes of myasthenia gravis is mainly the myasthenia gravis results from a decrease in the number of acetylcholine receptor. AChR stands for acetylcholine receptor. So some of the terms I'll just tell you here. ACH is acetylcholine, AChR is acetylcholine receptor, ACHE is acetylcholine esterase. These are the terms which we come across in the next few slides. So decrease in the number of acetylcholine receptor present on the motor end plate due to the production of circulating autoantibodies against these receptors. The postsynaptic folds are flattened or simplified. I'll show a diagram in the next slide. So these features you can see there. And due to the changes what I mentioned here, though the acetylcholine is released normally, the magnitude of the end plate potential falls below the threshold for initiating a muscle action potential. So this is the diagram showing, you can see the first figure. The figure A is a normal scenario, a normal situation where a neuromuscular transmission you can see in a normal way. You can see the release site and the acetylcholine receptors, see the muscle and the postsynaptic folds. But what happens in myasthenia gravis? The figure B shows myasthenia gravis condition where you can see there is a reduced acetylcholine receptors, decrease in the number of acetylcholine receptors and a widened synaptic space with flattened and simplified postsynaptic folds. So you can see the difference between the normal and what happens in the myasthenia gravis. So the highlighted feature, the etiology or the pathophysiology, you can see there is a decrease in the number of acetylcholine receptors, there's a widened synaptic space as well as a flattened and simplified postsynaptic folds. Coming to a important part, what happens, the anti-acetylcholine receptor antibodies have following three major functions. So the three major functions what the anti-acetylcholine receptor antibodies have are they compete with acetylcholine to bind to acetylcholine receptor, producing receptor blockade, and they induce endocytosis of acetylcholine receptor. They damage the postsynaptic membrane. Coming to the clinical features, an important part, as first slide I told you, in the characterized by weakness and fatigability. So fatigue is an important clinical feature. Normally, on repeated stimulation of the motor nerve, the amount of acetylcholine released per action potential gradually decreases. There is a presynaptic rundown, but the amount is enough to generate an end plate potential well above the threshold level. So what is happening in myasthenia patients, myasthenia gravis? In myasthenic patients, due to the postsynaptic changes along with the presynaptic rundown, after a few motor nerve impulses, the successive contractile responses become feebler. That results in fatigue. So also there is a decremental response to repetitive nerve stimulation on EMG, electromyography recording from the affected muscle. So there is a fatigue as an important feature of myasthenia gravis. The reason is what is mentioned here. The next important feature in the early symptoms are there can be ptosis as well as diplopia. This picture shows a female having ptosis in the left eye. Ptosis is nothing but the drooping of eyelids. So the extraocular muscles and the eyelids are often involved early in the course of myasthenia gravis, and diplopia and ptosis are the early symptoms. So this picture shows the ptosis of left eye. Women are more affected than men in the ratio of 3:2. Then there is muscle weakness which increases during prolonged use of the muscle and improves after rest or sleep. That's why the patient feels better in the morning but symptoms aggravate towards the evening or after exertion. The proximal limb muscles are commonly affected, and in severe cases there can be respiratory muscle paralysis which can lead to death. Coming to the physiological basis of treatment, these are the different treatment modality what is available right now. Administration of acetylcholine esterase inhibitors, ACHE inhibitors. Drugs such as pyridostigmine and neostigmine increases the concentration of acetylcholine at the NMJ. So pyridostigmine and neostigmine are the main drugs which can be given for the treatment of myasthenia gravis. It increases the concentration of acetylcholine at the neuromuscular junction. Thymectomy. Thymectomy is also helpful as the immune responses mediated by T cells are part of the pathophysiological mechanisms. Thymectomy blunts down the immune response and improves the condition. Then immunosuppressive drugs, immunosuppression, glucocorticoids and azathioprine can inhibit the immunological mechanisms, that is immunosuppression. And also there is something known as plasmapheresis. Plasmapheresis removes the acetylcholine receptor antibodies from the plasma. So these are the current modalities available for the treatment of myasthenia gravis. Administration of acetylcholine esterase inhibitors such as pyridostigmine and neostigmine, thymectomy, immunosuppressive drugs such as glucocorticoids and azathioprine, and plasmapheresis. That is about myasthenia gravis. So important question which comes is causes, clinical feature and physiological basis of treatment are the main important question. Frequently asked 3 markers it is, or as a part of long essay this is asked. So I hope this video will be helpful for you. Thank you.